Hi, this is Dr. Robert Chao reporting virtually from EULAR 2022 for Room Now. Today's the first day of conference, and I wanted to share with you all a rather interesting and unique way of looking at the diagnosis of psoriatic arthritis. And this study, which was oral presentation 0029, focused actually on the role of dermatologists for this condition. And also on their use of musculoskeletal ultrasound. So this study involved 12 dermatologists who were trained in the use of musculoskeletal ultrasound. Initially, they determined a potential diagnosis of psoriatic arthritis based on patients' medical history, clinical exam, and questionnaires. Subsequently, they then performed musculoskeletal ultrasound on up to 3 painful joints. And then these patients were referred to a rheumatologist who did the same thing, who did a history and physical and performed a musculoskeletal ultrasound and verified or ruled out the diagnosis. This study involved 140 patients and detected psoriatic arthritis in 24 of these patients. Pre-musculoskeletal ultrasound, the sensitivity was 81% and specificity of the dermatologist diagnosis was 54%. Post-musculoskeletal ultrasound, the sensitivity was 62% and specificity rose to 91%. The use of musculoskeletal ultrasound did lead to a change in the diagnosis of presumed psoriatic arthritis in 46 patients. And actually out of those, 45 patients had psoriatic arthritis ruled out. So overall, musculoskeletal ultrasound used by dermatologists increased the specificity while decreasing the sensitivity of diagnosis of psoriatic arthritis in this group. And the authors claimed this could lead to fewer false referrals from dermatologists to rheumatologists and potentially earlier diagnosis of psoriatic arthritis. So my own personal take on this is I'm all for earlier diagnosis of psoriatic arthritis, especially when trying to capture that 20% of psoriasis patients who may transition to psoriatic arthritis. I'm not so sure or confident that patients who dermatology suspects may have psoriatic arthritis should be denied a visit to a rheumatologist simply based on this data or on the use of musculoskeletal ultrasound alone, due to a few factors. Especially, we know that psoriatic arthritis is much more nuanced than just a patient with psoriasis and maybe a painful middle finger. We know the different kind of the multifaceted approach of this condition, including dactylitis, enthesitis, inflammatory bowel disease, uveitis, and so on and so forth. So I'm still a little hesitant on denying that visit to a rheumatologist based on just this data. And lastly, I think we are also very aware that the use of musculoskeletal ultrasound is very operator dependent. So I would imagine that a good and trusting rapport with your local dermatologist would be crucial in establishing this kind of relationship. So thanks for tuning in to Room Now for live coverage of EULAR 2022. And please follow me on Twitter at Dr. RBC. Thanks.